Part 1. Introduction to carcinoma. What is carcinoma? Carcinoma is a type of cancer that originates from epithelial tissues, which line the surfaces of organs and cavities in the body. It accounts for a significant portion of all cancer diagnoses, affecting various organs and systems. Part 2. The biology of carcinoma. Cell division and growth regulation. Normal cells undergo a controlled process of growth and division, regulated by genes that control cell division, repair, and death. In carcinoma, these genes become mutated, leading to uncontrolled cell growth. Mutations. Changes in the genetic material of cells can be caused by various factors, including exposure to carcinogens, radiation, viruses, and inherited genetic defects. Uncontrolled proliferation. Mutated genes disrupt the normal cell cycle regulation, causing cells to divide rapidly and uncontrollably. This leads to the accumulation of abnormal cells, forming a tumor. Loss of apoptosis. Normal cells undergo programmed cell death, apoptosis, when they become damaged or are no longer needed. In carcinoma, the apoptotic pathway is often disrupted, preventing the elimination of abnormal cells, further contributing to tumor growth. Invasion. As the tumor grows, it can invade surrounding tissues. This process involves the breakdown of the extracellular matrix and loss of cell-cell adhesion. Metastasis. The spread of cancer cells from the primary tumor to distant sites in the body is a major cause of cancer-related death. This process involves intravasation, circulation, extravasation, and colonization. Part 3. Epidemiology of carcinoma. Carcinoma is the most common type of cancer, accounting for 80% to 90% of all cancer diagnoses. The global burden of cancer is significant, with millions of new cases and deaths attributed to cancer annually. The most common types of carcinoma vary by region and population demographics. Part 4. Causes and risk factors of carcinoma. Causes of carcinoma. DNA damage and genomic instability lie at the core of carcinoma development. Risk factors for carcinoma. Genetics, inherited mutations, and family history can increase the risk. Environmental factors, tobacco use, sunlight exposure, radiation exposure, chemicals, and pollutants can increase the risk. Lifestyle factors, diet and physical activity, alcohol consumption, and obesity can increase the risk. Age, the risk of most carcinomas increases with age. Other factors, hormones, immune suppression, and other factors can play a role. Part 5. Symptoms and diagnosis of carcinoma. 1. Symptoms of carcinoma. Carcinoma symptoms can be diverse and often mimic those of other conditions. Common signs include changes in bowel or bladder habits, persistent pain, unusual bleeding or discharge, thickening or lumps, indigestion or difficulty in swallowing, chronic fatigue, unexplained weight loss, skin changes, cough or hoarseness, fever or night sweats. 2. Diagnostic techniques. Physical exam, examining skin changes, breast exams. Blood tests, detecting protein levels, enzyme levels, tumor markers, and other indicators. Imaging, routine imaging procedures like mammograms, colonoscopies, ultrasounds, MRIs, CT scans, PET scans, and X-rays. Biopsy, the only way to confirm a carcinoma diagnosis. Cancer staging. Cancer staging documents a tumor size, lymph node spread, and spread to other parts of the body. Stages range from 0, in situ, to 4, metastatic. Tumor markers and biomarkers. Tumor markers are substances found in the body produced by either cancer cells or healthy cells in response to cancer. Common tumor markers include CA125, CEA, PSA, AFP, and HCG. Part 6. Treatment options for carcinoma. Carcinoma treatment options are diverse and depend on several factors. Surgery, often the primary treatment for localized carcinoma. Chemotherapy, uses powerful drugs to kill cancer cells. Radiation therapy, uses high-energy rays to damage and kill cancer cells. Targeted therapy, focuses on specific genetic abnormalities that drive cancer cell growth. Immunotherapy, harnesses the body's immune system to fight cancer. Stem cell transplant, restores blood-forming stem cells. Hormone therapy, slows or stops the growth of carcinoma that relies on hormones for growth. Palliative care, relieves symptoms and improves quality of life for patients with advanced carcinoma. Part 7, Carcinoma Management and Supported Therapies. Managing carcinoma involves treating the cancer and addressing the various physical, emotional, and social challenges patients face. Pain management. Effective pain management is essential for improving quality of life. Nutrition and hydration. Maintaining adequate nutrition and hydration is crucial for overall health. Psychological support. Psychological support is essential to help patients cope with stress, anxiety, depression, and other emotional difficulties. Rehabilitation and physical therapy. These services help patients regain strength, mobility, and function after cancer treatment. End-of-life care provides comfort, dignity, and support to patients and their loved ones during a challenging time. Part 8, Cancer Prevention and Early Detection. Early detection strategies, regular checkups, imaging tests, and blood tests. Lifestyle factors for prevention, healthy diet, regular exercise, smoking cessation, and alcohol moderation. Part 9, Current Research and Future Directions. Personalized medicine, using information about a person's cancer to help with diagnosis and treatment. Immunotherapy advancements, using the immune system to fight cancer. Targeted therapies, targeting genetic changes or mutations that turn healthy cells into cancer cells.